Hi, I'm Dr. Grace Tassa, and today I'm going to speak to you about quality and wellness. As is customary at Providence, before I start, let's start with a reflection. So when I was in medical school, I read this amazing book called Search Inside Yourself. So it's written by Chade-Meng Tan, and he's one of the original engineers at Google, and he studied mindfulness. He got really into mindfulness and recognized that practicing mindfulness in his own life and mindful meditation helped him actually to be more productive. So he started a course at Google about mindful meditation. It became the most popular course that Google offers its employees, and he wrote this book based on that. So one thing I took away with me during medical school was what's called the one breath meditation. And it's simply that. It's when things are going crazy, you don't have time to sit and meditate for 20 minutes or anything like that. You can just do one breath. Breathe in, breathe out, only focusing on your breath and just on that exhale, letting out all the tension. So I hope that's something you can use in your practice for your own wellness. I like to use it when I'm about to go in the room of a very difficult patient. Just recognize it is what it is. One breath meditation, and then you go in there calm and open and ready to take care of them. So here's a little joke to poke fun at the fact that I'm sure you were surprised to see quality on the schedule at a wellness conference. So today we'll go through a little bit of history of quality improvement, model for improvement, how this relates to professional development, and we'll talk some about what quality and quality metrics mean in healthcare today, and close after that. There's debate about when quality improvement first began in medicine. One great early example is Dr. Semmelweis in Hungary. He recognized that women who had their babies at home had a much lower risk of postpartum infection than women who delivered in the hospital. Dr. Semmelweis realized that by introducing hand washing, he could reduce the amount of postpartum infections in his patients. He tried to spread this to the medical community at large. However, unfortunately, they were not receptive at the time. So without knowing it, Dr. Semmelweis was following what we call the PDSA model, Plan, Do, Study, Act. The PDSA cycle is a broadly used model for helping people rapidly improve quality or reach whatever target they're trying to reach. It's used in both healthcare and business models for improvement. So it's really an effective way to take whatever it is you're trying to accomplish. So the objective you have, one we'll touch on later as an example, is creating like a diabetes education group in your office. So whatever your objective is, it gives you like an easy little algorithm to follow. So you make a plan, how you want to go about this. You do it, you study it, and then you act on it. And sometimes acting on it is making a little modification and going through the cycle again. So we'll go through this in greater detail in just a moment. First, I want to go through a little bit about MACRA and MIPS and all these different payers out there now that are holding healthcare systems to quality metrics. In healthcare, quality often is seen as really something that's stressful for physicians because outside payers like Medicare, commercial insurers set quality metrics that physicians need to reach in order to get the reimbursement that they're seeking. So this is really seen as an added stress for a lot of physicians, and they don't see the upside so much. I hope something you can get out of today is starting a PDSA model for something you'd like to improve in your own practice. So if you could take a moment now and just see if anything comes to mind that you've been wanting to improve or that's maybe been irking you a little and it's something you would like to think further about improving, and just choose that as your topic or objective here. And then apply the PDSA cycle to it. So in the example, I have Dr. Smith, and he has been wanting to start a diabetes education group. So that's his objective. He plans to ask a patient, see how it goes. He asks his first patient if they have any interest in more education about diabetes, and they say they do. So now he has one interested participant, and his next action is to continue the cycle again until he gets 3 patients signed up for it, and he'll start his first diabetes education group. So just as we used the PDSA model to improve depression screening in our practice, and how Dr. Smith has used it here to start a diabetes education group, you can use the PDSA model in your own practice to improve both your and your patient's wellness. So I would like to go back for a second and highlight that when we went through our depression screening quality improvement project, we really depended there both on our ancillary staff and on technology, so letting the computer flag for us who was due for the screening, rather than laying all of that on the physicians as far as responsibilities for them. So that's something I would recommend if you are trying to improve something in your own practice. Really look to involve ancillary staff, use technology. If there's any administrative support available to you, look for that. So take as much as you can off your plate and share it with others. I hope between the one breath meditation and the idea of using the PDSA cycle to improve something in your practice that you've gotten something out of today's talk. And I know I'm not here at the talk, but I'm happy to take questions if you'd like to email me or reach out to me at a later time. Thank you so much for your attention.